the bureaucracy of doing creative things for patients. Like the system would rather tell a patient, I'm sorry, no one can help you, than say, okay, we're going to let our doctor who's willing to try to help you with something that may or may not work, and we're going to let them try. And instead, they would say no.
Real quick, when you talk about the system, what are you talking about? Are you talking about like life in academia or?
Yeah, I think mostly in academia, because I haven't really experienced it in private practice. Like, I think the hospital mostly cares about the fact that, like, a lot of the restrictions I had on myself in academia, like, for example, let's just take this example of doing a pudendal nerve decompression surgery. If I had tried to post that surgery as an academic, I think that somebody would have said, I don't have credentials to do that. And I wouldn't have been able to do it because they would have said, oh, you're going to need to go and you're going to need to get an IRB approval because it's an experimental procedure. We need to do this under the IRB. We need to get some lawyers together. We need to do it. And then at a certain point, you just go, forget it. Like the inertia, the slogging would be ungodly. And then you just go, forget it. Like, I can't do it. It's too much. Whereas in private practice, the first time I ever did a laparoscopic pudendal nerve decompression, I mean, I actually practiced it on cadavers a few times. And then I went and did it. I had a patient with endometriosis. I posted it in as an endometriosis surgery. And then I just moved my robot over to the side and did what I wanted to do. Nobody told me I couldn't do it, but I never would have been able to do in academia. So to some extent, like the structural weight of all the huge academic system was making me not able to do what I wanted to do professionally. And it was making me unhappy and not giving me the time to do what I wanted to do with my patients. It was not paying me that well. Like, I felt like I was trying to do sort of extraordinary things that no one else wanted to do, but those things had no financial value. And then I had a child too. I was remarried and I had a daughter. And like in the first 6 months of my daughter's life, I was like hardly home. I mean, I was like working my ass off and there was no end in sight. Like there was no time where I'm like, oh yeah, one day I'll be able to go to my daughter's soccer game. It's like, no, not really. I mean, like my current job is never going to allow that. And so I finally just like a coalition of things happened where I was just like, this is intolerable. And so then I decided to leave academia. And I honestly have never, but like everybody in academia is so certain that the academic life is like the pinnacle of medicine. And I am so much of a better doctor now than I was when I was in academia.
For us, by us, and just for us, this is Hope for Med.